in the textbook on dreams as well, and I talk about the three types of dreams: latent, patent, and the dreams that actually are not meaningful dreams. The non-meaningful dreams are essentially just a spasmodic release of bioelectrical, chemical transfer within the brain. It's no different from a little muscle twitch. We get a little twitch in an eyelid. Does that have great dramatic motor function meaning? Well, typically not. Hopefully it's not a neurologic disorder. Typically not. And so we'll have dreams like that that really have no meaning. Then we have patent dreams. What are patent dreams? Patent dreams are clear dreams. We know exactly where they came from. We know exactly what they mean. Today, on your way home, you step off the curbing, crossing the street, and a car rushes by, almost striking you, and it causes you to say, "Whoa, dude, that was close." You go home tonight, and in your sleep, you relive that experience. That is a patent dream. If we have to, is it okay, just 2 seconds? A latent dream is like a Fellini movie. It's a jumble. Day is night, night is day, male is female, female is male, up is down. We have this dream, and we wake up in the morning, and we go, "Wow, I had this really wild dream. I don't know what it was. I mean, this was just strange." That is the unconscious dealing with an issue that the unconscious says, "You want the truth, you can't handle the truth." And so what happens, it jumbles it all up inside the unconscious so that we can let that energy out. And again, in psychiatry, we can interpret dreams, and that is the royal road to the unconscious. Interpreting those latent dreams to understand how they deal with some intrapsychic conflict. Now, if we look at dreams, I'm going to ask, is there someone here in the room who is comfortable with playing cards and would allow me to ask their permission to participate in an effect with playing cards? Is that okay? May I ask, are you familiar with playing cards? Do you know one card from another? Yes, yes. Okay, may I throw you a box of playing cards and have you catch it? Don't worry, you'll do fine. No stress, I promise. Okay, are you ready? I'm going to throw it to you. Here it comes. Okay, I'm throwing you the box of cards, and I'm going to have you catch it. Good, good catch. Now I'm going to ask you, if you will, please, to open the box. Yes. And I'll have you remove the cards, and I'll have you set the box down. Now I'm going to ask you to go through the cards, and I want you to select a card, any card that you want. Don't tell me what it is. But I'll have you go through and take the card out of the deck, if you will. I'll have you square up the cards, face up toward the ceiling, and I want you to put your card in face down into the deck. Perfect. Perfect. Now I'll have you give the deck a couple of cuts, so we don't know where it is. Now I'm going to ask you, please, to put the cards back in the box. Okay, very good. And then I'm going to ask you to close the box. That's important. Yes. Now I'll have you throw the box back to me. Good throw. Now, you see, we're talking about dreams. Last night, this morning, at 3 in the morning, I dreamt we were going to do this. I got up, I went over to that box of cards, that deck, I opened it, I took out the deck, I went through it, and I selected one card. And I took it out. And I took the rest of the deck, squared it face up toward the ceiling in my hotel room, and put my card face down into the deck. And I put the cards back in the box, and there they have been since 3:02 a.m. this morning. Now, you merely thought of a card as really what you did is you pulled it out of the deck. And I'm going to ask, please, if you'll share out loud with all of us here in this room, what card you selected.
Ace of Spades.
The Ace of Spades. Now, I want you to know, no fast or sudden moves. My fingers never leave my hands. Nothing up my sleeves other than my arms. I'm going to open the box. I removed the deck. That's all. Now, we're going to go through and look for one face-down card. We're going to go go through, we're looking for one and only one face-down card. Now, you selected a card, yes? And the card you selected was the, you may tell us?
Ace of Spades.
Yes. There's only one face-down card in this deck. Now, I'm going to ask, if I may, I'm going to ask you, if you will, please, to remove that face-down card without looking at it. One and only one face-down card. Let's see how well dreams are the royal road to the unconscious. The one card I placed face down in the deck at 3:01 this morning. Would you please pick up that card and show us exactly what? Thank you. See you all on Friday, Thank you. That measures that energy, and I'd like to demonstrate this for you all. And if I may, could I ask for 2 volunteers from amongst our gathering here today? Would that be okay to help demonstrate this? I promise no one will be injured in the making of this demonstration. Thank you. I appreciate it. Thank you. Please, a round of applause. Thank you. Thank you. And if I may, thanks. I really appreciate it. This will help to demonstrate fundamental here. We're talking about energy. And what we're going to do is this. I'm going to ask, if you will, for this index finger just to touch that metal post. Great. And I'll have you, yes, gosh, you guys are great. We hear nothing. Nothing is happening right now. But now if you two will touch index fingers from your other hand, you hear that energy. That is not I. That is the energy flowing from these 2 individuals. If you remove the index fingers, it's gone. Now, if we can have 2 more folks come forward, please. Yes. As will be noted here, this is not a taser. You are not getting shot. If you guys touch index fingers, there is no sense. Yes.
Yeah.
Now you hear it. Thank you all for your help. Please, a round of applause for your colleagues. We could actually take the whole room and have everybody touch index fingers with 2 people here and go all the way, and you would hear the sound of all our electricity would be even louder and faster. And then we could sing songs and set up a campfire. But be that as it may, this is helping to show the concept of the energy that exists within us. Key element of life, water. It is a richly complex substance that is vital to our existence. Now, as you can see in this slide, water makes up a big part of us. Without it, we couldn't exist. You'll notice from the slide that lean muscle contains about 99% water by weight. Blood contains 70% water, body fat 10%, bone 22%. Skin has to be well hydrated, we know that. The human body is about 60% water in males, 55% water in adult females. And you'll notice the University of Georgia did the research on structured and unstructured water. The loss of that electron surrounds disease. Now, a bottle of water and a block of wood. At one time, this piece of wood was vibrant and alive. It was a tree. Now, it is inert. It is a piece of wood, 2 by 2 by 6. And you will notice in looking at this, what makes it so inert on the lack of water. So, I need your help for this, because what we are going to do is the energy that we demonstrated with our little recording device. I'm going to take this is an experiment, which means we may be able to make it happen, we may not. We'll balance a piece of wood against the water, and I'm going to ask you all now, please, to concentrate, to focus your energy, your positive energy, into that bottle of water and into the wood, because I want you to use your energy to excite the molecules in that bottle of water. Hopefully, you will create an excitation into that bottle of water that will push that block of wood just enough to make it move. Please concentrate. Good. You guys are good. Now, that's positive energy. Now, we also know today that there are forces on the brain that are negative energy. Now more than ever, we're understanding the concept of traumatic brain injury, the impact of shock waves on the human brain. Axonal damage begins within minutes of injury and continues for hours after the initial injury. The subsequent impairment of axonal transport causes swelling of the damaged processes in the brain. We know that some traumatic brain injury symptoms are due to this axonal damage and the subsequent loss of synapses. We don't know the exact cause. We do know that excitotoxicity, that's death of neurons by overexcitation, and oxidative stress have been suggested due to free radicals. We're seeing now and understanding that blunt trauma is not the only cause of traumatic brain injury. We know that shock waves can cause brain injury. We're seeing so many men and women coming back now from combat due to shock waves causing traumatic brain injury. And we are seeing the results. Impact in mood, impact in interaction with others, impact in cognitive functioning. So we're beginning to see this and understand it more and more. And we're going to demonstrate this now. A hand-painted glass that I recently purchased. Cover the hand-painted glass to protect you, because I'm going to ask you to do something now. I am going to ask you, if you will, to focus your energy again. I want you to concentrate again, if you will. This time what I'm going to ask you to concentrate is negative energy. We did the positive energy. You excited the water molecules, and you were able to move that block of wood, to bring it back to life, as it were. Now I'm going to ask you, please, to focus your negative energy inside that plastic container. And as that negative energy builds, we're going to see something happen. And this is what can happen with shock waves that injure the brain. Because as you watch closely, as you focus your energy, you see, you can make things happen. Damage can occur. Injury. And we're seeing this more and more today when patients present with traumatic brain injury. Psychotherapy. Psychotherapy is no less painful than surgery. It is surgery of the mind. While hopefully it is bloodless in its performance, it requires the individual to go deep within him or herself to find the intrapsychic conflicts that exist. And we're going to talk about this during the course, and I'll give a lecture on Sigmund Freud and his approach to psychiatry. The role of the therapist, the role of the psychiatrist, is to guide the individual through the paths, helping them to avoid the pitfalls and declines that can occur. It can be very, very difficult and painful. And today in psychiatry, we also prescribe medication, and in so doing, we also have to be aware of potential risks and side effects of the medication. We have to be careful because our medications are not without risks. They're serious medications. Visual demonstration. spike, a very sharp, pointed titanium spike. And I'm going to ask, if I might, please gently, if you will, gently touch the tip to verify it is in fact a pointed, sharp spike. Yes. I ask you to hold your hand out if you will. I'm just going to set that in. You agree that's a heavy spike. It is what it appears to be. This spike represents the pain, the discomfort that occurs in therapy on our path to healing and health and well-being. I'm going to ask, if I may, if there is one amongst us here today that feels comfortable doing the following. I'm going to step forward with my back to this table so I cannot see where the spike is. And I'm going to ask someone to come forward. And I'm going to ask you, please, and I ask you, if you will, and if you will allow me an extra 2 minutes here just to complete this, I'm going to ask you to move the spike wherever you'd like it to be, so that I don't know where it is. I will ask you to keep it on the table and under one of the tubs, and then please cover it, leaving enough space between them. And then when you are done, to say, I am ready, and then I will come back to the table. So please, may I ask you to come forward and do that? Is that okay? I will step forward so my back is to you. And I'm going to ask you to move this wherever you want it. The rest of the room will know. Then cover them so I have no idea where the spike is. Is that okay? Very good. I will step forward. When you are done, I will have you say, Dave, I'm ready. This represents in many ways what we experience when patients present to us for psychotherapy. From session to session, we never know where they're going to be within themselves, where the conflict will be. It is our goal to keep moving the patient through the conflict, to help them resolve that conflict, to find return to health and well-being from within. How are we doing? Are you ready?
Dave, I'm ready.
Thank you. Excellent. I'll let you go forward. Thanks for your help. Please, a round of applause. Our goal, that was not to take a peek. Our goal is to help the patient move through the minefield of resolving an internal conflict. Our goal is to understand the inner workings of the id, the ego, the superego. To understand the defense mechanisms that we will talk about in a special lecture, and to help our patients, if we need to use medication, and to do so in a way so that the patients do not end up with potential risks, side effects, and they get the benefits. And I want to thank you all very much.